What is thyroid myopathy and how is it diagnosed? Imagine waking up one day and feeling that your muscles just don't work the way they used to. You might find climbing stairs or lifting objects suddenly much harder. This could be a sign of thyroid myopathy, a muscle condition linked to thyroid hormone levels. It's important to understand that your thyroid gland, a small butterfly-shaped organ in your neck, plays a big role in controlling your body's energy and metabolism. When it produces too much or too little thyroid hormone, it can affect your muscles in different ways. Thyroid myopathy happens when abnormal thyroid hormone levels cause muscle weakness, fatigue, and sometimes muscle pain or stiffness. It can affect anyone with thyroid issues, whether they have an overactive thyroid, called hyperthyroidism, or an underactive thyroid, known as hypothyroidism. The symptoms often develop gradually but can sometimes appear suddenly, especially in severe cases. In hyperthyroidism, or an overactive thyroid, the excess thyroid hormone can cause muscle weakness mainly in muscles near your trunk, like your hips and shoulders. People might notice they tire easily, have muscle cramps, or feel heat intolerant. Sometimes, severe muscle breakdown can occur, which might lead to kidney problems. In rare cases, muscles involved in swallowing or speaking may become weak, leading to difficulty in those areas. On the other hand, hypothyroidism, or an underactive thyroid, usually causes muscle weakness that develops slowly. You might experience muscle cramps, stiffness, or a feeling of heaviness. The muscles may also enlarge slightly, a condition called pseudohypertrophy, which is not true muscle growth but swelling. Over time, if hypothyroidism isn't treated, muscle damage can become more serious, affecting your daily activities. Diagnosing thyroid myopathy involves several steps. First, your doctor will ask about your symptoms and perform a physical exam, checking for muscle weakness, cramps, or stiffness. They will look for signs of thyroid problems, such as weight changes, temperature sensitivity, or changes in heart rate. Blood tests are essential. Measuring thyroid hormones like thyroid-stimulating hormone, free T4, and free T3 helps determine if your thyroid is overactive or underactive. Elevated thyroid hormones point to hyperthyroidism, while high TSH with low T4 suggests hypothyroidism. Sometimes, your doctor will order tests for muscle enzymes like creatine kinase, which can be elevated if there's muscle breakdown. Electromyography, a test that records electrical activity in muscles, can help distinguish thyroid myopathy from nerve-related issues. In rare cases, a muscle biopsy might be needed to look at muscle tissue directly, especially if the diagnosis isn't clear. It's also important to evaluate whether your respiratory muscles are involved, especially if you experience breathing difficulties. Additional tests like lung function tests or swallowing studies may be recommended. The key to managing thyroid myopathy is treating the underlying thyroid disorder. Restoring normal thyroid hormone levels often leads to improvement or complete resolution of muscle symptoms. During this process, physical therapy can help maintain muscle strength and function. If you notice persistent muscle weakness or fatigue, it's vital to consult a healthcare professional. They can perform the necessary tests and develop a personalized treatment plan. Remember, each person's experience with thyroid myopathy can be different, and proper medical care is essential. By addressing the root cause, most people see significant improvement in their muscle health and overall well-being.